In this video, we'll discuss about antifungal drugs. Drugs used for superficial and T fungal infection. So these are the drugs used for superficial and T fungal infection. The fungal infections are associated with intake of anti-cancer drugs or intake of immunosuppressant or intake of corticosteroids or broad spectrum antibiotics. The fungal infection are also associated with dentures, catheter, implant and HIV infection. So, drugs used for superficial and T fungal infection. The fungal infections associated with intake of anti-cancer drugs, intake of immunosuppressant, intake of corticosteroid or broad spectrum antibiotics. The fungal infection are also associated with dentures, catheter, implant and HIV infection. Now, all these factors which associated with fungal infection. Fungal infection also associated with dentures, catheter, implant and HIV. Which associated with the fungal infection, they break down the host defense. Because of this breaking of the host defense, the fungi invade the tissue. Fungus invade that tissue and result into fungal infection. So what will happen? The fungal infection, they break down host defense. Break down the host defense. Because of this breaking of host defense, the fungus invade the living tissue and result into fungal infection. Now, Candida albicans is the normal resistant of the oral cavity. Candida albicans is the normal resistant of that oral cavity, but in the host defense, they reduced the Candida proliferate. They reduced Candida proliferate and resulting into candidiasis. So Candida albicans is the normal resistant of that oral cavity, but the host defense, then they reduced the Candida proliferate and resulting into candidiasis. Now, a classification of antifungal drugs. Classification of that antifungal drugs are Azoles, Allylamine, antibiotic group and topical group of drugs. Four main groups: Azoles, Allylamine, antibiotics and topical group of drugs. This azole group is further divided into imidazole and triazole. Azole further classified into divided into imidazole and triazole. The imidazole have two types, topical and systemic. Topical and systemic. This triazole include fluconazole, itraconazole, voriconazole, posaconazole. So this triazole included fluconazole, itraconazole, voriconazole, then posaconazole. The imidazole further classified into topical and systemic. The imidazole which act topically are clotrimazole, icanazole, micanazole, aziconazole. Okay, what are the things here? This topical azole which act topically. This imidazole in this one topical which act are clotrimazole, icanazole, then micanazole, then oxyconazole. These are the four drugs comes under topical category. Then systemic imidazole acting ketoconazole. Okay, that systemically acting imidazole is ketoconazole. Then second group of drugs, this allylamine which include derpinephrine alone. Derpinephrine only comes under this allylamine group. Then third group are antibiotics. Antibiotics which further divided into three groups. One is polyene, then echinocantins, then heterocyclic benzofuran. These are the three drugs comes under the category of antibiotics. So antibiotic further divided into three groups: polyene, echinocantine, and heterocyclic benzofuran. The polyenes groups included amphotericin B, nystatin, and hemicin. In this polyene group, we have amphotericin B, nystatin, and hemicin. In this echinocantins group include caspobenzene, and micabenzene. In this echinocantine group included this caspobenzene and micabenzene. Heterocyclic fenfuran include greasephulvine. Next, fourth group of drugs, topical agent, include tolnabate, antisilenic acid, benzoic acid, cyclophosphamide, then butynaphine, and cunitocolor. These are the drugs comes under topical. In this topical, we have this tolnafate, antisilenic acid, benzoic acid, cyclophosphamide, then butynaphine, and cunitocol. These are the drugs. So in this one, first we want to discuss this azole group. This azole group including imidazole and triazole. So the azole group are extensively used antifungal drugs. This one used in antifungal drugs. They have broad spectrum of activity against candida, mycosis, nocardia, and leishmania. So this azole group is extensively used. It have broad spectrum of activity against candida, mycosis, nocardia, and leishmania. The mechanism of action of this imidazole, it inhibit fungal lanosterol 14 demethylose. So this one will inhibit fungal lanosterol 14 demethylose. This inhibition of that fungal um, lan- lanosterol 14 demethylose impair. Okay, this one impair ergosterol synthesis. This enzyme will impair ergosterol synthesis. As a result into membrane abnormalities in the fungus. So what it will do, it will inhibit this fungal lanosterol 14 demethylose. This one, what it will do, impaired ergosterol synthesis. As a result membrane abnormalities in this fungus. Next drugs, cotrimazole. Cotrimazole used in topical treatment of tinea infection. This one used for tinea infection like ringworm, athlete foot, jack itching, like that. It is also used for oral, cutaneous, vaginal candidiasis. So this clotrimazole used for tinea infection like ringworm, athlete foot. Then it also used for oral, cutaneous and vaginal candidiasis. Uh, this one, more than 80% of cases of candidiasis respond to this clotrimazole. So more than 80% cases of candidiasis respond to clotrimazole. Then it is most commonly used drugs in oropharyngeal candidiasis. Most commonly used drugs in oropharyngeal candidiasis. For the treatment of oropharyngeal candidiasis, 10 milligram trozi of 10 milligram trozi of clotrimazole dissolved in mouth 3 to 4 times per day. For treatment, 10 milligram trozi of clotrimazole dissolved in mouth 3 to 4 times daily. Now, the tincture stomatitis can be treated clotrimazole lotion or gel. The tincture stomatitis can be treated with clotrimazole lotion or gel, which is applying on the fitting surface of the tincture. So where we are applying surface of the tincture, fitting surface of that tincture. Next, topical clotrimazole also used for treatment of angular cellitis. Topical clotrimazole also used for treatment of angular cellitis. So next drugs, iconazole. Iconazole, which is similar to clotrimazole, and it is used in dermatophycosis, automycosis and thrush. So this one used for treated dermatophycosis, automycosis, thrush. These drugs has no adverse effect. Next drugs is miconazole, which is alternative to clotrimazole, and is used in tinea, then titiriasis, then automycosis, and oral vaginal candidiasis. So this meconazole used for treat tinea, titiriasis, automycosis, oral vaginal candidiasis. Adverse effect of that meconazole local irritation, but no systemic adverse effect are reported. Then Azoles. Azoles is the new drugs in this group. It is a new drugs in this group. It is used in tinea and dermatophytosis. Used in tinea and dermatophytosis. Next drugs, ketoconazole. Ketoconazole now that are systematically acting. This one systematically acting imidazole, which include ketoconazole. It is the first orally active antifungal agent. First orally active antifungal agent which has broad spectrum of activity and is used in dermatophytosis. Dermatophytosis. This ketoconazole used for dermatophytosis. This one ketoconazole is the first orally active antifungal drugs. Ketoconazole used for dermatophytosis, candidiasis and teeth mycosis. The pharmacokinetics of ketoconazole, pharmacokinetics of ketoconazole, it is a good oral absorption. It good oral absorption. It found to albumin and RBC in the body. It metabolized in liver and excreted in urine and feces. So it is a good oral absorbed material bound with albumin and RBC, metabolized in liver and excreted in urine and feces. The dose of ketoconazole is 200 mg ODPD. The T half of the drugs is 1.5 or to 6 hours. The adverse effect of ketoconazole: nausea, vomiting, loss of appetite, headache, then paresthesia, rashes and hair loss. What are the side effects? Nausea, vomiting, loss of appetite, headache and rashes and hair loss. Next, interaction of ketoconazole. The ketoconazole interacted with hydrogen blockers. So ketoconazole interacted with hydrogen blocker, proton pump inhibitor and reduce the absorption of ketoconazole. These two drugs inhibit that absorption of ketoconazole because the drugs are intended to reduce the acidity in the stomach. If the acidity is reduced, the absorption of ketoconazole is reduced. So this one interacted with the hydrogen blocker, proton pump inhibitor and reduced that observation of that ketoconazole. These drugs inhibit absorption of that ketoconazole, and these drugs are intended to reduce the acidity in the stomach. If that acidity is reduced, that absorption of ketoconazole is reduced. Secondly, rifampin, phenobarbital, rifampin, phenobarbital, then carbamazepine and phenytoin. So rifampin, phenobarbital, carbamazepine and phenytoin increases the ketoconazole metabolism. The increased metabolism reduced the efficacy of the drugs, increasing metabolism, reducing that efficacy of the drugs. Thirdly, the ketoconazole reduced the cytochrome 450, result increasing blood level of certain drugs. These drugs include warfarin, sulfonylurea, phenytoin, cyclosporin, diazepam, and idinvir. So the ketoconazole reduced cytochrome 450, P450, result increasing blood pressure level. Sudden drugs, these drugs include warfarin, sulfonylurea, phenytoin, cyclosporin, diazepam, idinvir. Next, uses of ketoconazole used in tinea, thermal mycosis, dandruff, and systemic infection. Used in tinea, thermal mycosis, uh, dandruff, and systemic infection. Next drugs is fluconazole. It is water soluble drugs. Water soluble drugs which have broad spectrum of activity. And it is the fungicidal. And it active and shows good result in vagina, nails, and saliva. It is the fluconazole is the water soluble, having broad spectrum of activity, and it is the fungicidal. It active and shows good result in vagina, nails, and saliva. The pharmacokinetics of that fluconazole, it's 94% observed orally. These drugs 94% observed orally. The T half of the drugs 25 to 30 hours, and it is excreted in the urine. The T half of the drugs 25 to 30 hours, and it is excreted in urine. The adverse effect included nausea, vomiting, abdominal pain, rashes, and headache. Nausea, vomiting, abdominal pain, rashes, and headache are the side effect of fluconazole. The interaction of fluconazole, um, this is active hepatic metabolism. Active hepatic metabolism of drugs resulting increasing plasma concentration of phenytoin. Increasing plasma concentration of phenytoin, cyclosporin, warfarin, zidovudine, and sulfonylureas. So interaction active hepatic metabolism of drugs resulting increasing plasma concentration of phenytoin, cyclosporin, warfarin, zidovudine, sulfonylureas. Uses of fluconazole. Orally the drugs is used in 150 mg per day into 2 weeks. It is the first line drugs for candidal esophagitis. So orally these drugs we are using 150 mg per day for 2 weeks. It is the first line drugs for candida esophagitis. For tinea infection and cutaneous candidiasis, use 150 mg weekly for 4 weeks. Tinea infection and cutaneous mycosis, we are using 150 mg weekly for 4 weeks. Then that cryptococcal meningitis infection means cryptococcal meningitis means we want to use 200 to 400 mg daily for 4 to 12 weeks. Next, itraconazole. Itraconazole is have broad spectrum antifungal drugs. It is fungistatic in action. So it have broad spectrum activity antifungal drugs. It is the fungistatic action. Then pharmacokinetics, it absorption variable in orally. Absorption variable in orally, it is highly protein bound, metabolized in liver and excreted in feces. So absorption variable in orally, highly bound with the protein, metabolized in liver, excreted in feces. The T-half of itraconazole is 30 to 64 hours. The dose up to 200 mg per day, well tolerated. Dose more than above 400 mg per day, intolerated. So 200 mg per day tolerated, this one intolerated. Then adverse effect of this itraconazole, dizziness, pruritus, headache, hypokalemia condition, unsteadiness, unsteadiness and impotence. So dizziness, pruritus, headache, hypokalemia, unsteadiness and impotence. Then drugs interactions, absorption reduced by that absorption of this itraconazole reduced by antacid, okay, antacid, then hydrogen blockers, proton pump inhibitors. So that absorption is reduced by antacid, hydrogen blocker and proton pump inhibitors. Then now increase metabolism or decrease efficacy of itraconazole. Increasing metabolism or decreasing efficacy of itraconazole is reported with concurrent intake of rifampin, barbitones, then phenitones, and carbamazepine. Though so here that increasing metabolism or decrease efficacy of itraconazole is reported with concurrent intake of rifampin, phenobarbital, then phenitone and carbamazepine. Next, uses of itraconazole. It is used in systemic mycosis, aspergillosis, vaginal candidiasis and dermatophytosis. Used in systemic mycosis, aspergillosis, vaginal candidiasis and dermatophytosis. Now coming to second group of antifungal drugs, the Allylamine groups. Allylamine groups, which include terbinafine, which is fungicidal. Now the mechanism of action of terbinafine is non-competitive inhibitor of squalene epoxidase. This result into accumulation of squalene epoxidase in the fungal cell. This squalene epoxidase is accumulated in the fungal cell and this enzyme is fungicidal. It kills that fungus. So this squalene epoxidase enzyme will accumulated and it will kill that fungus. Next, the pharmacokinetics. It absorbed orally. The distribution in the body is wide and the drugs terbinafine have high keratin affinity, so it is accumulated in stratum corneum on the skin. So it accumulated stratum corneum of the skin. Side effects of terbinafine: gastric upset, rashes, taste disturbance, hepatic dysfunction, then hematological disorders. Other side effects including erythema, itching, dryness, irritation, and rashes. So main side effect gastric upset, rashes, taste disturbance, hepatic dysfunction, hematological disorders. Others included erythema, itching, dryness, irritation, and rashes. Of terfenadine, it is used in 1% topical cream for tinea pedis, tinea curis, or tinea corporis. Oral treatment onychomycosis and tinea capitalis. So this one percentage used that cream, topical cream for tinea pedis, tinea curis, tinea corporis. Oral treatment for onychomycosis and tinea capitalis. Third group of that antifungal drugs, this one antibiotics, which having three group: polyene, echinocantins, and heterocyclic benzofuran group. Okay, in this antibiotic we have three groups: polyene group, echinocantine group, and heterocyclic benzofuran group. In this one, first we want to discuss polyene. Polyene is the principal drugs which is that amphotericin B. What is polyene? Polyene means is highly double bonded structure. That polyene is, have some macrocyclic ring. It having macrocyclic ring with the conjugated double bond on one side. One side it having conjugated double bond. On the another hand, it having OH group. OH group. This conjugated one lipophilic in nature. Another side OH group, this one is the hydrophilic in nature. One side lipophilic in nature, other side hydrophilic in nature. Now this polyene have increasing affinity for ergosterol which present in fungal cell membrane. Polyene have increasing affinity for ergosterol which is presented in fungal cell membrane. These polyene combined with ergosterol and that polyene are inserted in the cell membrane that result in the formation of microphore. This microphore, okay, through this microphore the iron and amino acids leach out, and this increases the cell permeability. So what is the function? Polyene combined with this ergosterol which is presented in the fungal cell membrane. Now this combination are inserted on the cell membrane as a result in the formation of microphore, through which the iron and amino acid leach out and increasing cell permeability. The bacterium, next that spectrum of activity of amphotericin B, it against candida albicans, histoplasma capsulatum, cryptococcus neoformans, then plastomyces dermatitis, then coccidioides immitis. So this amphotericin B we are using against candida albicans, histoplasma capsulatum, cryptococcus neoformans, plastomyces dermatitis, coccidioides immitis. Amphotericin B, amphotericin B in higher concentration is fungicidal, lower concentration is fungistatic. Okay, so lower concentration static, higher concentration cidal. Now the pharmacokinetics of amphotericin B, it is not absorbed orally, but it is active in gut lumen and topically. So it administered by IV route, and it has a wide distribution. The elimination T half of the drugs is 15 days and 60 percentage of the drugs metabolized in liver and excretion in urine and bile. So this one, pharmacokinetics of amphotericin B not absorbed orally but active in gut lumen and topically. So this one will admitted by intravenous route. It have wide distribution. Elimination, the T half is 15 days. 60 percentage of the drugs metabolized liver and excreted urine and bile. The adverse effect of amphotericin B: acute reactions, chills, fever, ache, nausea, vomiting, dyspnea, then thrombophlebitis. So adverse effect: acute reaction, chills, fever, ache, nausea, vomiting, and dyspnea. In the long term toxicity, it causes nephrotoxicity, azomia, then decreasing glomerular filtration rate, then otomycosis, and cold stand of antifungal therapy. This one used for cold stand of antifungal therapy and also active against the leishmaniasis. So here long term toxicity: nephrotoxicity, azotemia, decreasing glomerular filtration rate, then acidosis, hypokalemia, and anemia. Then uses: we can treat candidiasis, automycosis. Then it is the hold stand for antifungal therapy and also active against the leishmaniasis. So treatment purpose: candidiasis, automycosis, leishmaniasis we can use. Next, drugs, nistidine. It is derived from Streptococcus naursii. Streptococcus naursii. It has similar action to amphotericin B, but it has higher specific toxicity. Higher specific toxicity. Tendal use of nistidine. Topical nistidine is the second choice of drugs. Okay. Clotrimazole. Second choice of drugs is clotrimazole. Then this nistidine can used effectively in oral thrush, tincture, stomatitis, antibiotic associated stomatitis, then steroid associated stomatitis, candida leishman on lips. So this one effective in oral thrush, tender stomatitis, antibiotic associated stomatitis, steroid associated, and candida lesion on lips. Then second group of antibiotic, echinocantins. Second group of antibiotic, echinocantins. Echinocantins are semi-synthetic cyclic lipopeptide. These are semi-synthetic cyclic lipopeptide and less toxic than amphotericin B. The first group of this echinocantins group, caspofuscin. Caspofuscin, the broad spectrum of activity against the candida, aspergillus and resistant type of candida. Aspergillus resistant type of candida. The mechanism of action, caspofungin inhibit the synthesis of beta 1,3-glucagon, which is unique component of fungal cell wall. If this is inhibited, the production of normal fungal cells. Then pharmacokinetics, pK value, it is not observed orally, so it will be given by IV route. It diffuse in the tissue, metabolized the liver in liver and excreted in bile and urine. The plasma T half of the drugs 10 hours. So pharmacokinetics of these drugs, caspofungin, this one observed orally. Okay, this one is not observed orally, through IV only we want to give. It diffuse the tissue, metabolized in liver and excreted in the form of bile and urine. The plasma T half is 10 hours. Then uses of drugs used in esophageal, this one esophageal candidiasis, non response aspergillosis, non-responsive aspergillosis, and febrile neuropenia, neutropenia. So this one used for esophageal candidiasis, then non-responsive aspergillosis, febrile neutropenia. Third group of antibiotics including hydrocyclic benzofuran. The represented drugs of this group, griseofulvin, it is derived from penicillium griseofulvin, and it is fungistatic in nature. Griseofulvin interferes with cell mitosis, resulting in formation of multinucleated and stunted fungal hyphae. So what will happen here? These drugs interfere with cell mitosis, as a result in formation of multinucleated and stunted fungal hyphae. Griseofulvin also interfere with microtubule functions, resulting in abnormal metaphases. Then adverse effect, low toxicity, headache, GI upset, then central nervous system symptoms, then peripheral neuritis. What are the adverse effect? Low toxicity, headache, GI upset, CNS symptoms, peripheral neuritis. Uses of the drugs used for dermatophytes, but this one orally inactive. Fourth group of antifungal drugs, topical. First one we want to discuss tolnaftate. It is active in Tinea cruris and Tinea corporis. These drugs, tolnaftate, active in Tinea cruris, Tinea corporis. This one responds to treatment within 1 to 3 weeks, but the drugs has poor penetrating power, so it is effective against Tinea pedis and Tinea cophitis. Next drugs, cyclophosphamide. It is used for the treatment of tinea infection, tyriasis versicolor, then terminal candidiasis and vaginal candidiasis. Next, anthocyaninic acid. It is the fungistatic. It is used topically. It combined with zinc salt, and used in treatment of tinea pedis, nappy rash, and tinea cruris. It is used for treatment of tinea pedis, nappy rash, tinea cruris. Next, benzoic acid. It is a antifungal and antibacterial drugs. It is weakly fungistatic. So anti-fungal and antibacterial drugs, weakly fungistatic. This one combination of benzoic acid and salicylic acid. Combination of benzoic and salicylic acid, which is called white filled ointment, which is used in hyperkeratotic lesion of the tinea. So the combination of benzoic acid and salicylic acid name is called whitefield ointment, used for hyperkeratotic lesion of tinea. The adverse effect include irritation and burning sensation. Then next, buprenorphine. Drug's name is called buprenorphine. It is container of terfenadine. So mechanism of action similar to terfenadine. It is used in treatment of tinea cruris, tinea corporis, and tinea pedis. So used for treatment of tinea cruris, tinea corporis, tinea pedis. Then final drugs is cuneo-tocular drugs, which is luminal amebicide, luminal amebicide, and it is weakly antifungal and weakly antibacterial too. Then this one used for dermatophytosis, mycosis, then seborrheic dermatitis, then pityriasis verticaler. So these drugs, final drugs, buprenorphine used for dermatophytosis, mucosis forbe, then seborrheic dermatitis, pityriasis versicolor. So in this video we discussed antifungal drugs. What are the Azole group, topical and systemic, triazole group, Allylamine, antibiotic group, topic groups. Azole group, mechanism of action, clotrimazole, uses, treatment, icanazole, micanazole, oxyconazole, ketoconazole. Then their pharmacokinetics, adverse effect, fluconazole,